In this video, we will go over the origin, insertion, and action of some of the thigh and the leg muscles. Starting with the gracilis muscle, we can see it right here. The action, it adducts the thigh, flexes and medially rotates the leg during walking. Right here, this is part of the leg, and this right here is the thigh. Adducts, meaning when you add the lower extremity toward the midline of the body, this is adduction. The origin, which is the immovable attachment site, is the inferior ischiopubic ramus and the body of the pubis. The pubis is one of the three bones that form the hip bone. The insertion, it is inserted on the medial surface of the tibia, which is this bone right here, just inferior to the medial condyle. The medial condyle is a structure located on the tibia. Moving to the rectus femoris muscle, which is one of the four muscles that form the quadriceps femoris muscle. The rectus femoris, it extends the knee and also it flexes the thigh at the hip joint. So that is the thigh. The origin is the anterior inferior iliac spine. Right here we have the anterior superior iliac spine. Right under it we have the anterior inferior iliac spine. Also, the origin is the superior margin of the acetabulum. The acetabulum is a structure on the hip bone that is located laterally. It receives the head of the femur, and this forms the hip joint. The insertion is on the tibial tuberosity and the patella. So this is right here, we can see the tibia, the tibial tuberosity is located right here, and that is the patella. Moving to the vastus medialis muscle. The vastus medialis muscle is one of the four muscles that forms the quadriceps femoris muscles. The action, it extends the knee and it stabilizes the patella. The origin of the vastus medialis muscle is the linea aspera, which is a structure on the posterior aspect of the femur, the bone in the thigh. Also, the origin is the intertrochanteric line. It is a structure also on the posterior aspect of the femur between the two trochanters. Moving to the insertion, the vastus medialis, it is inserted on the also tibial tuberosity and the patella, similar to the rectus femoris muscle. Moving to the semitendinosus muscle, right here we can see the semitendinosus muscle. The action, it extends the thigh, it flexes the knee, and it medially rotates the leg. The origin is the ischial tuberosity. The ischial tuberosity is a structure on the ischium, which is one of the three bones that form the hip bone. The insertion, it is inserted on the medial aspect of the upper tibial shafts. The tibia is the medial bone in the leg. Moving to the semimembranosus muscle, the action, it also extends the thigh, it flexes the knee, and it medially rotates the leg. The origin is the ischial tuberosity, and the insertion, the medial condyle of the tibia, and also the lateral condyle of the femur. Moving to the tibialis anterior muscle, which is one of the leg muscles, it is the prime mover of the dorsiflexion. When you flex the dorsum of the foot, this is dorsiflexion. It also inverts the foot when the soles are facing to the inside, this is inversion, and supports the longitudinal arch of the foot. The origin is the lateral condyle and the upper two-thirds of the tibia. Also, the interosseous membrane, which is the membrane between the tibia and the fibula. Moving to the insertion of the tibialis anterior muscle, it is inserted on the inferior surface of the first cuneiform and the first metatarsal bone. Cuneiform is one of the tarsal bones in the foot, which is located medially, and the first metatarsal is also located medially. Moving to the gastrocnemius muscle, which is located on the posterior aspect of the leg, the action plantar flexes the foot. So this is plantar flexion of the foot when the knee is extended, and also it flexes the knee when the foot is dorsiflexed. The origin, the medial and the lateral condyles of the femur, which is the bone in the thigh. The insertion, it is inserted on the calcaneus bone via the calcaneal tendon right here.